Well, at the beginning, we found that many of our patients and community members were already getting information from different resources, and not all of them were accurate. We also know that there is no one-size-fits-all solution that helps us address misinformation, questions, and filling in gaps in knowledge. Our patient population, they speak over 27 languages and have different levels of literacy, and not all of our patients have access to reliable or access at all to the internet. We knew that whatever information we created needed to be tailored to each population and needed to come from a variety of trusted messengers so we can have the greatest impact. Due to the rise in COVID cases and updated Alameda County guidelines around face coverings during the summer of 2020, we created the Mask On to Move On campaign to help complement public health information efforts. We really wanted to combat misinformation and negative associations surrounding face masks and highlight the need for face coverings with the emphasis that if we have any chance of moving beyond this pandemic, moving on with our lives, we really needed to mask on to move on. We started working with renowned local artist Lena Wolf and graphic designer Masimi Chen, and we came up with these different scenarios that helped graphically depict people of different backgrounds living their lives whilst wearing face coverings. And our intent was to show joy and movement using soft colors in comfortable and familiar settings. We wanted to show a world where we were all hoping we could eventually get to. So in addition to the printed posters and digital designs, we actually also had a multilingual COVID hotline phone number that people could call in and ask all COVID-related questions. And we made sure that this phone number was added to each piece of collateral. The print posters and the digital social media cards were created in 6 languages: English, Spanish, Chinese, Vietnamese, Korean, and Tagalog. We were very cognizant of how a direct translation of what we thought was a catchy term in English might not necessarily translate or even resonate with different communities. We tested the materials with our own very diverse staff, as well as working with the diverse staff from our health centers to ensure that translations were culturally appropriate and would make sense to those communities that we were trying to reach. For example, our Tagalog message went from mask on to move on to with mask, there's hope. We worked bilaterally with the County Department of Public Health, the City of Berkeley, faith-based and other community organizations, and we distributed about 30,000 reusable cloth masks, 3,000 posters, 50,000 postcards, and 10,000 rack cards, all multilingual, of course. We noticed that within weeks, different vendors actually had them up on their store windows, at their checkout lines, and every single week we made sure that there was a deliberate social media campaign that would focus on one very specific scenario in the collateral. We evolved the campaign to reflect current events. For example, during the 2020 election, it was mask on and vote, all the while ensuring the mask on to move on messaging was kept throughout the evolving messages that we put out there. We formed an ad hoc committee with our own staff here, as well as staff from each of our health centers. And this became a place for peer learning and sharing about best practices and shared efforts. What the health centers decided they needed were a multilingual vaccination FAQ. So we put together a very simple what, why, how, when, etc. Just breaking it down piece by piece, what all the components of the vaccination. We were getting asked a lot of questions from patients and community members. Questions like, will the vaccination change my DNA? Will I get COVID from the vaccine? And then there was some fear-based questions from some of our patient population with regards to information sharing. Patients wanted to know if their immigration status will be asked for before they get the vaccine. And we created these myth versus fact rack cards to address all of these questions, to put their mind at ease with simple, yes, this is protected. No, this is not going to happen. Yes, vaccine providers may not share any personal information about you with any agency outside of the healthcare system. Things like that to really, really make our patient population and community members feel comfortable.